Dr. Mehboob, Smart Pet Clinic. The topic is Aspergillosis in poultry, brooder pneumonia, an infectious disease mainly of respiratory tract of birds characterized by acute miliary infection of lungs in young chicks and as a chronic air sac infection in adult birds. Etiology: disease is caused by inhalation of spores of a fungus, Aspergillus fumigatus. Epidemiology: susceptible host, chickens and turkeys, canaries, geese, ducks, ostriches, pheasants, captive and wild birds. Very common disease of zoo birds, particularly pigeons. Transmission: moldy food and litter. Birds become infected from inhaling spores. Hatchery contamination: up to 1/3 of hatches may become infected. The fungus may penetrate the eggshell during incubation, decreases hatchability. Contaminated vaccine: occasionally factors influencing susceptibility. High humidity and temperature favor the growth and spopulation. Serious outbreaks may occur. It is becoming very common due to suppression of bacterial infection with antibiotic. Any age may be affected, but it is a high mortality in young chicks, in brooder. In adults, few affected at all. Debilitated birds have increased susceptibility. Bad management. Clinical findings: symptoms may be respiratory, digestive and nervous. Respiratory sign: nasal discharge, dyspnea and gasping. Digestive sign: inappetence, emaciation and diarrhea. Nervous sign: convulsions are associated with brain damage. Blindness, usually unilateral, result from lungs or air sac infection rather than from direct eye infection. Encephalitis. Postmortem findings: so necrotic masses may be seen under the nictitating membrane. Lungs, grayish white in color and consolidated. Nodules vary from pinhead to pea size, 1 to 3 mm, and consistency. Mycelial masses may be seen in air passages and bronchi. Air sacs. Firm caseated nodules, often called buttons, are attached to wall, thick and grey. Picular plaque formation, best described by resembling stemless flat headed mushrooms, are found on membranes. Superficial epithelial lining thickened and covered by mat of green sporulating mycelium. Rare circular disc-shaped necrotic mass. Histopathology: focal pneumonia, fibrinous or catarrh, multiple necrosis. Nodule formation: center radiating hyphae may be surrounded by inflammatory cells. Foreign body giant cells are frequent. Diagnosis: field lesions are characteristics. Isolation and identification of fungus or fungi. Mycelial elements are found on lesions. Cultural substrate, serological identification, skin reaction and immunodiffusion. Differential diagnosis: Newcastle disease, infectious bronchitis disease, and chronic respiratory disease. Prevention and control. Hatchery should not be located near feed mill and other installations which exhaust organic dust. Hatchery sanitation, fumigation, eliminate the source of spores. Overcrowding must be avoided. Litter management and feed management. In face of outbreaks, sacrifice the affected birds and remove offending infected material. Treatment. Nystatin, amphotericin B, and potassium iodide are effective against that disease. Thank you.